Good afternoon. Hola. My name is David Ortiz. I am a student doctor. ¿Español o inglés?
English.
English. Okay. All right. I'm just gonna desanitize my hands. I don't want any germs. Mind if I sit? So this is Julian. This is Cleo, and again we're student doctors here. I'm just gonna ask you a few questions, kind of get to know you, see what kind of brought you in, if you don't mind, and this is all just to better help you, better get an understanding of how we can help you. First thing, your name?
Christopher.
That's Christian? Wait, Christian or Christopher?
Christopher.
Christopher. Got it. Last name?
N.
How do you spell that?
A-N-A-C-K.
A-N-A-C-K. Awesome. How old are you, Christopher? Do you go by Chris?
Christopher.
Okay. Your age?
44.
44. And again, I'm going to be taking some notes. I don't want to miss anything because again, just more detailed we are, it just helps out in the long run, and it's just kind of required for me to do so. If you don't mind my asking the ethnicity, like I'm Hispanic. She's she was mind me saying of German descent. Yourself? Oh, sorry, European.
Yes. Hispanic.
Okay. Is that Mexican American or from South America?
I don't know what I'm saying.
Okay, no problem. I understand. So what brings you in today?
I don't know. I'm supposed to be here. Just I guess a checkup.
Okay,
Follow-up.
awesome. It's actually healthy practice there. It kind of helps. I mean, if you are feeling healthy, you'll stay feeling healthy a little longer. Are you currently a student? Are you working?
Work.
Okay. Where do you work? If you don't mind asking.
United Airlines.
Do you travel a lot? What do you do there at United Airlines?
I'm a pilot.
Oh, okay. What's your favorite flight?
Don't have any. Just.
How long have you been working for United Airlines?
15 years.
And do you live here in the area?
Yeah.
Okay. An apartment? Do you?
A house.
Okay, awesome. Awesome. So you're here for a checkup. So these are just kind of basic questions that we ask a lot of all patients. Are you currently on any medications?
No.
Okay. No. What about nothing for high blood pressure? What about cholesterol? Do you have any allergies? Are you allergic to, let's say, pollen, dust?
No.
Okay. Are you allergic to any medicine?
No.
Okay. Nothing like penicillin. Not allergic to. Okay. Do you drink alcohol at all? It's not terrible, actually.
No.
Okay.
Occasional. Yes.
Okay. When it's occasional, is it usually like about how many drinks?
One per week.
Okay. What about tobacco? Do you smoke or chewing tobacco? Okay. What about any drugs, like marijuana or cocaine?
No.
Okay. Do you exercise? Any at all? Okay. Okay. Do you often go for walks? Okay. What about your diet? Would you say you eat fairly regularly?
Yeah.
Okay.
High fat. Eat out.
Okay. Yeah. About how many times a day?
3, 2, 3.
Where do you usually eat?
McDonald's, Taco Bell, any taco place.
Do love tacos. Okay. I mean, better than nothing. Do you sleep? That was a bad question. About how much do you sleep a night?
6, 4 to 6.
Okay. So that's usual, either in between 4 to 6 hours per night. So you said that you don't have a. Well, no. Did you have hypertension? Do you have a history of hypertension?
Don't know.
Okay. What about cholesterol?
Don't know.
Okay. When was your last checkup?
Don't remember.
Okay. So, would you say within the year, or has it been like 6 months, a year, maybe closer to 5 years,
Yeah.
somewhere around that time frame? Okay. So it's good that you're here now. So I'm gonna go into your family history. That's just gonna it's gonna help get a better understanding of, again, your health and what risk, certain risk factors. And then we're gonna kind of go over. I'm just gonna ask you some questions about each part of your body, just to kind of, again, help aid this checkup, to make sure, to see if we can pinpoint things that we might want to look into a little bit more, if that's all right. Your parents, mother and father, are they currently with us?
Yeah.
Okay. Do you know if they have any health problems like hypertension or diabetes?
No, I don't know.
Okay. Sometimes they call it. I forget. Sorry. Okay, so do you have any siblings? Brothers, sisters?
No.
Okay, so only child? Alright. So I'm gonna go into kind of review your body, if you don't mind. Do you get headaches? ¿Te duele la cabeza?
Yeah, sometimes.
Okay. How often?
I don't speak Spanish.
Oh, okay, sorry. My apologies. Been working on my Spanish. It's kind of on the mind. So headaches. You said sometimes. About how often? Is that regular, or is that just every now and then?
At night.
At night. Okay. Is that every night?
No, it's when I fly. At
Okay.
night.
So when you fly at night, then you get the headache. Do you usually fly overnight?
Sometimes.
Okay. Do you take anything for the headache?
I don't know.
About how many pills or dosage there do you have to know?
Just 2.
Two pills. And you take it right when you feel the headache?
Yeah.
Do you have any blurry vision?
No.
Okay. Do you don't see, you don't have a double vision either?
No.
Okay.
Learners, you have 5 minutes remaining.
Do you have any sore throat?
No.
Sore throat. What about Any phlegm, mucus coming out from your ears, nose, eyes, or mouth?
No.
Okay. Do you have difficulty swallowing the food? Any food that you eat?
No.
Okay. Do you have any neck pain? Chest pain?
No.
Your heart, does it? Do you feel that it's racing sometimes? Do you feel it's too slow at times? You feel it? Okay. Do you ever have shortness of breath? Okay, so that was respiratory. Any coughing?
No.
Wheezing? Okay. What about, so now we're gonna go to the stomach. Any abdominal pain when you touch your stomach? Any? Okay. Any vomiting or diarrhea? So, how often do you go to the bathroom each day?
Don't remember.
Okay. Do you have diarrhea? Maybe some irregularities with the bowel movement?
No.
Any pain when you urinate? Okay. Do you have any? Like I said, what about your skin? Do you notice any rashes?
No.
What about fatigue?
No.
Your energy level's pretty stable.
Yeah.
Okay. Are you sexually active? If you don't mind my asking about how many partners?
One.
Okay. And do you? Again, we ask this. We lose just questions. We have to use protection.
Yeah.
And condoms, birth control.
Yeah, condoms.
Okay. So how's your joints, your legs, arms? Do you have any problems with movements?
No.
Okay. Do you have any questions for me? Okay. So you're here for a checkup, which is great. The headache, the only from what we went through, we went through your chest, your breathing, your heart, your stomach, kind of like your bowel movements. I didn't ask you about urination. Does it hurt when you pee? Okay. Any blood when you pee? Okay. You said your joints are okay. Again, you don't have any known medical allergies. Not allergic to anything. So I'm gonna repeat some of the stuff back. Alcohol, maybe one drink a week. Don't do tobacco. You don't do drugs. You don't really exercise, and you sleep about 4 to 6 hours a night. Sometimes you have overnight flights, and when you do have, you at times have a headache when flying. Do you have any dizziness? Okay. About how much water do you drink a day?
Not much. I don't remember.
Okay. Do you have any fluids during the day?
No.
Coke, water.
Sometimes Coke.
Okay. Sometimes. Better than nothing. And your diet say you eat about 3 times a day. Fast food. Again, any questions for me? Anything that you feel that you're worried about that might have caused you to come in today?
No.
Okay. So again, just getting that checkup. So I would recommend one thing, just because I do have a certification in nutrition advising. I would just try to increase water a little bit. What has helped others is carrying around a jug or a water bottle and refilling it. I know there's some water filling stations that are
Learners,
springing up.
please exit the room.
But I will, let me, if you don't mind, I'm gonna present this to my, to upper management and see how best we can help you. But, thank you, Christopher. And, let me just double check I got it right. It's A-N-A-C-K? Okay, thank you, Christopher.
Thank you.